Hello there. Toxic multinodular goiter. First, let me give you a small introduction about the thyroid gland. The thyroid gland, it produces thyroid hormones, that is T3 and T4. In every person, the T3, T4, the thyroid gland, it is maintained in a specific quantity. So, who maintains that? How it is maintained? So, the signal comes from the brain from two different levels. From the hypothalamus to pituitary. From pituitary, you have a hormone called TSH, which gives signals to the thyroid gland to produce the T3, T4. That means more of TSH, more of T3, T4 is produced. So, when the specific quantity of T3, T4 is produced in the blood, when it reaches that level, it gives a negative feedback to the brain to decrease the level of TSH. So, in short, the thyroid hormone production, it's under the control of brain through the TSH hormone. Please keep this in mind. That is one. Now, when the thyroid gland is enlarged, we call it goiter. Sometimes what happens is, inside the thyroid gland, there will be so many nodules. When you have more than 2 nodules, we call it multinodular goiter. In blood, when the thyroid hormone levels are more than what is required, it is called as hyperthyroidism. And when it is less, we call as hypothyroidism. So, as you see in this picture, you have 3 nodules. So, and the whole thyroid gland is under the control of TSH, which I have already explained to you. Sometimes what happens is, this nodule, one of the nodules, it takes up its own decision that it will produce T3, T4 of its own, and it is not under the control of TSH. It becomes an autonomous action. So it is not under the control of TSH anymore. So what happens? It starts producing thyroid hormone. So you have too much of T3, T4 in the blood. That means in multinodular goiter, one of the nodules become hyperactive and results in hyperthyroidism. Such a condition is called as toxic multinodular goiter. Why this is happening, I have already explained. This is more common seen in elderly patients and in those areas where iodine is less in the diet. Now, the usual complaint of the patient will be, they say that I have been having this thyroid gland problem, enlargement, for a long time. And I know that my doctor has already told me that I have some nodules. But of late, I am getting some problems. I am becoming nervous, I have tremors, and I have too much of palpitation. Why is that, doctor? So, on examination, we find out he is in a hyperthyroidism state. And we have to confirm that also. On examination, his heart rate will be more and it will not be beating regularly. So normal heart rate is between 60 to 80 per minute and the rhythm has to be normal, regular. But that is not the case in this. So what happens? This can lead to secondary complications. So that is not good. So the one single toxic nodule, it has produced all this problem. It results in cardiac problems mainly. So do you have hypothyroidism state? Yes, except for the eye changes. So if you want to know only about hyperthyroidism, not about these toxic nodules, not about multinodular goiter, just hyperthyroidism, then you can go to YouTube. I have uploaded a video. Dr. Zakir Hussain ENT hyperthyroidism. You type, you will get all the details about hyperthyroidism. But here, this is about toxic multinodular goiter, and that one particular nodule has become toxic, means it is producing more of hormones leading to hyperthyroidism. All the problem except for eye signs. Now, we need a diagnosis. We do a blood test. So, in that blood test, T3 will be elevated, TSH will be low. So, we have a diagnosis. This is hyperthyroidism. Next, we need to know this hyperthyroidism. We have to diagnose this hyperthyroidism because of toxic nodular goiter. How are you going to do that? So we will do a ultrasonography neck. The report is going to be thyroid gland is enlarged, the node, we have so many 2 or 3 nodules, and in that one particular nodule is hyperactive, in the sense there is more of blood supply in that. So still we have a diagnosis, but not for sure that it is toxic. But we know it is hypothyroidism, and the gold standard of diagnosis is going to be iodine scan or thyroid scan. So I'll tell you about the thyroid scan and radio ablation treatment in the second part. Now we have confirmed that it is hypothyroidism. We have confirmed this is multinodular goiter, and we have planned for thyroid scan also. Sometimes we need to do TRH stimulation also. So investigation done. There are so many other related investigations. I am not going into it because I am sticking to the topic. Now coming to treatment. The main treatment for this, you have to, with radioactive material, we are going to burn the toxic nodule. Means the better term is ablate the toxic nodule. That is the golden standard treatment. In that case, why I have put it as a number 2 here? Because this thyroid problem, will let it be multinodular goiter or toxic or whatever the problem is, it will be managed in your town or city. But when it comes to the radioactive material treatment, we need a nuclear medicine department, which is seen only in a higher center. So it takes time to go there, and it takes time for your appointment to start treatment. So we cannot wait till then. So we have to start treatment. So what? Now we have to start with anti-thyroid medications. So that's why I put anti-thyroid medication as 1. Radioactive ablation is 2. Then we have to control the secondary effects in the heart. We need beta blockers. And in some cases, surgery will be the indication. In some centers, what they do is they inject one particular material into the intralesional, into the toxic nodule, and try to ablate. That is also there, scientifically proved. That is about the treatment. In that, the best treatment is going to be radio ablation. Now, coming to anti-thyroid drugs. There are a few anti-thyroid drugs. Let me name 1 or 2. The first being carbimazole, and second being PTU, that is propyl thiouracil, which is more preferred in pregnant ladies. And carbimazole or PTU, whichever the drug is, the doctor is going to fix a dose for you, depending upon the blood level and your complaints. Now, before starting the medication, we'll do some blood test. Why? Because there are few side effects for this. One is the blood count can come down. Second is you can have liver problems, liver hepatitis. So it's always better to know do a basic workup so that we can have a comparison later on. So that is 2. Other side effect being there will be skin rashes and there will be joint pain and body pain. These are the few side effects to name. Now, once you have started your anti-thyroid drugs, your complaints, it is going to come down within 2 to 4 weeks. Clinical complaints. But the blood test is going to be normal only after 4 to 6 weeks. That is about anti-thyroid drugs. Now, about thyroid scan and radio ablation, I'll tell you in detail about the preparation, how we are going to do it, which material we are going to use it, what are the precautions to be taken at home, what are the complications related to that, and the indications for surgery. For that, please do watch part 2 of toxic multinodular goiter. Thank you.